Heparin and warfarin. Both are anticoagulants and decrease blood clotting. Both inhibit coagulation process indirectly and do not involve direct degradation of blood clots. You prefer heparin in some patient over warfarin and vice versa. Well, this is due to certain differences between both drugs. For details of heparin and warfarin, you can watch detailed lecture in Pharmacology course at sqadia.com. Here, I'm just going to list down the 8 differences between heparin and warfarin, and we will see how this affects their administration and efficacy. Well, chemically, heparin is a sulfated mucopolysaccharide, so it bears negative charges. This is the reason it is not absorbed in the GIT and administered through parenteral route only, whereas the warfarin is a coumarin derivative. Coumarin is a phytochemical containing benzene ring. They show 100% oral bioavailability. For this reason, they are mostly given through the oral route. Heparin is an indirect anticoagulant. It acts by increasing the effect of antithrombin. Let me remind you here that antithrombin together with the proteases inhibit the conversion of fibrinogen to the fibril. Well, heparin promotes this inhibition, whereas warfarin is also an indirect anticoagulant. It blocks the vitamin K recycling, thus decreasing its availability for clotting factor synthesis. This results in decreasing the blood clotting factors and clotting. You can study details of both processes in hemostasis lecture at sqadia.com. Moving on, warfarin works slower than heparin. Well, this is because warfarin does not cause degradation of existing clotting factors. These clotting factors take some time to disappear completely, usually 3 to 5 days. Whereas heparin produces an immediate effect. This is the reason why sometimes heparin and warfarin are administered together in the start of anticoagulant therapy. Just like the clotting factors take some time to disappear, it takes some time to resynthesize them. Therefore, warfarin has long duration of action as compared to the heparin. For warfarin, it is 3 to 6 days, whereas for heparin, it is 3 to 4 hours only. Strict dose monitoring is required for both heparin and warfarin. This is done through 2 laboratory tests, PTT and PT. PT is the prothrombin time. It is done for the warfarin, whereas the PTT is the partial thromboplastin time, and it is done for the heparin. Now you want to know the difference between both? Watch our video on PT versus PTT. Well, both names are quite similar, so you may get confused. Let me tell you a handy thing to remember them correctly. Heparin goes with PTT and warfarin with the PT. Counting them on fingers as HEPARIN, heparin, and PTT. Heparin has 7 letters and 3 will add more to make 10. These 3 comes from the PTT. So you can remember it like PTT for heparin. So for warfarin, we can count like WARFARIN, warfarin, and PT. So you see 8 letters for warfarin and 2 will add more to make 10. So PT for warfarin. This is a good way to remember which lab goes with which medication. Heparin cannot cross the placenta and do not appear in breast milk, but warfarin does. Warfarin causes serious fetal abnormalities by interfering with the fetal proteins, hence contraindicated for pregnant women. Warfarin also shows more drug interaction than heparin. Well, this is due to the excessive protein binding and hepatic metabolism of warfarin. Heparin metabolism process is not clear yet. The last one. In case of overdose or toxicity, you need an antidote to counteract the excessive effect of these medications. Well, antidotes are available for both drugs. For heparin, it is protamine, and for warfarin, it is phytomenadione or vitamin K. So that was all. Recalling the 8 points, heparin and warfarin are different in terms of route of administration, mechanism of action, onset of action, duration of action, drug monitoring, ADRs, drug interactions, and antidotes. Hope you guys are now well familiar with the differences between heparin and the warfarin. This was all for today. For more such videos, stay tuned to sqadia.com.